what we're looking at is how do you use data and data intelligence to understand more about a disease such as cancer, but also to use it to help patients in relation to how we look at, for example, pathology images, scanning images, etc., and how we can use that information, bring it all together and use it to help in cancer, for example, in relation to earlier diagnosis. Because if we diagnose cancer at an earlier stage, it's much more easy to treat. Or if we want to look at ways in which we can use this to develop algorithms that will allow us to develop new treatments for cancer.
And, there's a proposal overnight that more cancer doctors, more cancer consultants should work from home, and somehow we're going to get better diagnoses that way. That seems very odd to me. Do you support this idea?
Essentially what we're looking at is how do we look at ways in which we can maximize the information that we gather on cancer patients, and how can we do that in the most efficient way. And obviously we've got used now to looking at a hybrid approach in terms of consulting, teleconsultations, for example, for patients, but it still has to be very much that hybrid approach. And certainly there are certain things we can do that we can look at images, for example, while making sure obviously those images are completely protected and anonymized in relation to data safety, for example, to avoid any data breaches. But certainly Mike Richards has suggested this, and certainly there's merit in looking at ways in which we can do this. I think one of the big challenges, Nigel, and you've talked about this yourself on previous programs, is we really need to look at ways in which we can reverse the backlog that's accumulated because of COVID. And, for example, work that we did in Europe showed that there's probably 1 million people walking around with a cancer diagnosis that they don't know they have. So we're in a race against time to identify those people so that we can then diagnose them properly and give them the appropriate treatment. So I think we do need to think a little bit outside the box. I know it sounds a little bit odd at first, but it's looking at different ways in which we can maximize the capacity of the health service so that we do address the backlog. Obviously, 1.6 million backlog. We need to look at innovative ways to do that.